Ako si Clark Trovela, second year Doctor of Medicine student mula sa UERM.
My full name is Romina Castro. They call me Doc Mina. I am a medical doctor, an obstetrician, gynecologist, skin health physician that is, and I work now full-time as in a government institution with a COVID facility that is the National Center for Mental Health, and I am currently medical officer for. I go on duty 12 hours per day, 7 straight days, and then afterwards 2 weeks off for our quarantine period. Been in the institution since 2007, so 14 years by August 1.
Why do you want to become a doctor? Actually, babalik tayo sa pagkabata ko. Noong mga 8 years old kasi ako, naoperahan ako sa puso. And then, super naging idol ko talaga yung doktor ko kasi sobrang bait niya. Ang galing niya makipag-relate with my family, with me as the patient. So, parang I looked up to her. And nadala ko na lang din siya. Tapos, nung nag-college na ako, nagbago yung perspective ko na hindi lang ako mag-doktor dahil pangarap ko siya. Kumbaga, nakita ko siya as a vocation or a profession na makakapaglingkod ako sa sambayanan or sa mga tao na nangangailangan. Especially as a UP graduate, nakita ko yung kahalagahan talaga na mag-serve sa field ng medicine dahil maraming people yung walang access to healthcare.
Actually, I did not choose to be a doctor. I was chosen to be the doctor in our family. It was my father's ultimate dream to have one in the family. Hence, here I am. My siblings were all good in mathematics and I was not.
In the Philippines ngayon, especially ng COVID-19 pandemic, lip service na tinuturing bayani yung mga healthcare workers. Dapat lang naman talaga. Pero malaki yung disjunct sa pag-treat sa kanila or pagsabi sa kanila na bayani sila kaysa doon sa nangyayari sa kanilang compensation, especially ngayon na maraming mga healthcare workers ang overworked and underpaid dahil nga skeleton workforce. At the same time, may kakulangan talaga sa healthcare professionals. So, I think that the healthcare professionals deserve better, especially ngayong COVID-19 pandemic, talagang deserve nila ng mataas na sahod, deserve nila ng hazard pay because they've been given their lives or they've been giving their lives ngayong COVID-19 pandemic.
Upon reading this question, this is quite a difficult question. I can only answer for myself being a frontliner or backup in our COVID facility since I am an obstetrician and not an internist. Yes, I guess health profession is being recognized, but only very minimally. That's according to my opinion. I'm just lucky that I work in a national government hospital wherein the supplies and benefits are still on, albeit delayed.
First time kong mag-online classes, tapos first year ka rin sa online med school. So, I was a master's student before, and then nung nag-med student na ako, nag-transition na to online classes, and first year ako. So, I was adjusting to med school at the same time, I was adjusting with the online learning. And it was no easy feat. It was very hard kasi masanay talaga ako sa experiential learning sa setup ng classrooms, and may limit talaga yung online classes. So, nahirapan din ako kasi sanay ako mag-aral sa labas, sa libraries, or sa coffee shops. Pero ngayon, sa bahay ka lang pwede mag-aral given na may mga restrictions in mobility. So, marami talagang adjustments na kailangang gawin or kinailangang gawin. And it was really hard to adjust.
Oh, a lot. I have to prioritize things. So I closed my private clinic, stopped seeing private patients, and so on. I am a happy-go-lucky single woman. Your parents know that very well. I love to travel, hang out with your parents, go to the malls and shop. But during this pandemic, I should not only think of myself, but primarily my family, my friends, my patients, the whole nation. And most significantly, I practiced and got the habit of praying the rosary every single night. We need we really need some spiritual guidance from above. Ako naman, kasi from part-time sa NCMH, I applied as for full-time na. So, it's okay for me to give up yung clinic ko outside kasi I work there. Kapag hindi ako duty sa COVID ward namin, regularly nandun ako Monday to Friday, 7 to 4. So, for me, it's okay na. Hindi na ako maghahangad ng over than that.
Actually, di ba parang before the pandemic pa, alam naman natin na marami na talagang problems yung healthcare system natin. It's urban-centered, it's foreign-dominated. At the same time, di ba, maraming problems in terms of access to medicine, yung mga tao, access to healthcare. So, napalala lang siya nung COVID-19 pandemic. Na-realize ko na marami pa talagang kailangang baguhin or work on sa healthcare system. Na yun, as medical students, di ba, in the future na magtatrabaho tayo, kahit ngayon, di ba, kailangan natin siyang strive, no, na mabago at mapunan yung mga current na pagkulang or yung current na kakulangan sa access to healthcare system.
Oh, I only have one answer to that. You have to learn to trust God. That's all.
Medyo related siya sa sagot ko kanina. So, yun nga, maraming problems in terms of access to healthcare systems. Kasi ngayon, di ba, like, ang dami pa rin mga taong walang access, lalo na sa mga rural areas. At the same time, andyan din yung issue ng availability. Kung available ba yung mga healthcare services, at kung affordable ba siya, di ba? Kasi mahal magpagamot sa Pilipinas. So, at hindi rin talaga super sapat yung mga services ngayon, di ba? Especially ngayong COVID-19 pandemic. So, ito yung mga kailangan nating mabago talaga and ma-improve, no? Dahil yung mga tao ngayon, di ba, lalo lang in the crisis of pandemic, ay nangangailangan talaga ng better healthcare services.
I am not an expert on this, but I guess the ones in the position should think or plan 10 steps ahead of everything before it's too late.
Kasi pangarap ko talaga maging doktor and nakita ko na ito talaga yung profession na makakapaglingkod ako or makakapag-serve ako sa mga nangangailangan at sa mga tao in general. So, yun Doon ako, yun yung hinuhubutan ko ng lakas ng loob na this is where I'm best at. This is where I could give my knowledge and skills at. Especially na ako talaga super interested ako in health education, in educating people, in terms of diseases, di ba? Of vaccination. Ngayon, di ba, yun yung kailangan. So, yun talaga yung mindset ko na dito ako kailangan. At ito yung calling ko. At kung ano man, di ba, dito ako makakapagbigay ng aking buong mga skills at talents para magpagaling ng mga tao.
To be specific, the fulfillment that I feel every time I finish a 7-day COVID ward duty in our facility, nobody or nothing can replace the feeling of fulfillment. As I have mentioned, every after duty, knowing that I was able to serve my fellow Filipinos who are suffering from COVID-19. At first, during the start of pandemic, we doctors, not only the frontliners, even the backups, all the doctors in general, we feel depressed. Depression, disappointment, frustrations, all of them. It is normal not to be normal. It's okay not to be okay during those times of pandemic, especially last year, because we were a bit shocked of how our government handled our situation, and you can just hold on to God. That's all I can say. Hold on to God. Keep praying. Everything will be okay. And uh, fortunately, the doctors, the number of doctors who were dying, who are dying compared to last year, greatly improved. I mean, hindi na masyado unlike last year. Kasi because siguro as we go on, we learn. Like ako, OB ako pero I know na how to manage a COVID patient. I know how to diagnose mild, moderate, severe, critical. And I guess that's fate.
First of all, we salute all of the medical professionals right now who are helping in combating COVID-19. Hindi madaling trabaho ito, super hirap ang trabaho nito. People, especially health professionals, are risking their lives to be able to contain, manage, and battle this pandemic. So, we really salute all of you for being or staying true to your profession. And ang message ko lang din talaga is we hope, people hope better working conditions for you. Sana po ay talagang mabigyan po kayo ng karampatang mga salary, ganyan, hazard pay, at yung protection na kailangan ninyo syempre. Dahil you also need to protect your lives, di ba? To be able to save more people. So, again, we salute all the frontliners right now battling this COVID-19 pandemic.
Oh, nilista ko yan. Kasi parang medyo dramatic. Okay. To all aspiring doctors of medicine, always remember to put God as your first line of protection and defense, and you'll never go wrong. For me, medicine is not a profession, but instead a devotion. You should be devoted in treating your patients and making them well. Learn the beauty of compassion. Treat your patient as your family, or maybe put yourselves in their shoes. In this time of pandemic, I understand that a lot of you, especially kayo pre-med pa lang a lot of you are having second thoughts in pursuing your career. But no, be a superwoman like me. Kaya niyan.